More than 7,000 nurses at two major hospitals in New York City went on strike yesterday. The nurses at Montefiore and Mount Sinai hospitals say they are demanding fair contracts that improve patient care. Here's what one nurse who works in Mount Sinai Hospital's neonatal ICU said yesterday.
I'm in charge of 56 babies at a time, and I also have to be responsible for my staff that's on the unit. So you can imagine trying to be in charge of 20 nurses and 56 babies is extremely stressful. However, at the same time, all of my nurses have 3 to 4 babies and all needing something differently. So it just, poses huge challenges for us because we can't give the right amount, the care that we want to our babies. So the whole issue comes down to staffing. We can't be stretched this thin anymore.
New York's private and public hospitals still have at least 17,000 nurses working. The privately owned hospitals are postponing non-emergency surgeries and diverting ambulances to other medical centers in efforts to handle the walkout. Joining us now, Matt Allen. He is a labor and delivery nurse at Mount Sinai and director at large for the New York State Nurses Association. So, Matt, give me a sense of where things stand right now in terms of what the nurses need to get back on the job. And can you talk to me a little bit about the decision to strike?
I mean, what we're looking for right now is really, strong, safe staffing enforcement in our contract. That's something that has been lacking, for years now. And it's allowed the hospital to continue to kind of provide us with inadequate staffing. What the NICU nurse was talking about, right? Those nurses have been taking care of double the amount of sick babies for years now, and they've been crying out for help to hospital administration, but nothing has come of it. So that's why we're here now, right? We've pushed and pushed. We were trying to use our contract negotiations to improve our working conditions. The employer refused to budge on those things. So we are using our rights as the unionized workforce to go on strike. Because we need to push back. We can't accept the status quo anymore. And that's what we realize. And that's why we need to flex our power right now to say enough is enough. We need better. We demand better. This hospital needs to do better. So that's why, all of us nurses on the two hospitals are out on the picket lines right now.
Yeah. How long were the negotiations before the decision to strike was made? I wonder that must have been a tough decision to an extent for many nurses to leave what they do for their patients. So how long and were they given ample warning that this could happen?
Yeah, I mean, we've been negotiating, since September. And we have been talking about our contract renewal for, about a year and a half now with the nurses. But we have been at the table with management since September. And I think that's what's frustrating for us is that, they refused to budge during that entire time and have waited till, has pushed things to this limit, right? We could have come up with solutions beforehand in, September, October, November, but it's been dragged out. And they have not taken it seriously until, we issued a strike notice. That's when they actually started talking to us unionfully. And it's now pushed to this point where we're on strike. So we've been educating our members about it for, over a year now. And we've been in talks with management since September.
Hey, Matt, you mentioned, obviously, some of the staffing issues, but just tell us a little bit about, for those watching at home, the toll the last years have taken on you guys. New York City, of course, was the epicenter of the first wave of the COVID outbreak here in the United States. Still, cases are on the way up again, as well as, of course, flu and RSV. So just talk about how you guys are holding up after all these years.
Yeah. I think our staffing was, a huge issue, before COVID. And COVID, completely exacerbated that. People left the workforce. Sorry, everyone's getting really excited back here. People left the workforce because of the intense burnout we were having. And we continue to leave now. And unfortunately, the hospital did implement an unofficial hiring freeze, so we left with lots of vacancies. And that has left our working conditions really severely understaffed. Mount Sinai has currently 500 vacancies, so that means almost every unit is understaffed. We come to work, we're taking care of double the amount of patients we should be. We're not getting a break. we can't provide the care that we want to, that we went to school expecting when we came out that we should be providing to the patient. That is demoralizing for us. That breaks our hearts. And we see the impact that has daily on New York City.
Labor and delivery nurse at Mount Sinai and director of large at the New York State Nurses Association, Matt Allen. Thank you very much for sharing your story with us this morning.